Afternoon, family and friends. Uncle Fester here. All right. Um, just thought I'd come on. Actually, a bit bored today. All right. This lockdown, this tier 4 situation we're in, there's one thing it actually generates, and that is boredom and loneliness. All right. Been in tier 4 now since before Christmas, and yeah, there's only so much meditation. There's only so much you can do. Box sets, going for a walk. So the boredom kicks in. This morning I find myself going out for a walk, and I stopped off in a cafe, which one of my friends owns, and I found myself having a bacon and egg sandwich. But I got into a bit of a debate this morning, and the debate I got into this morning was who benefits from COVID-19. Yeah, we know it's real, all right, and we know it's killing people. But the big question I've got is, which was raised today in the debate, was COVID-19 and face masks. All right, I'm going to show you a short video. I'm going to share a short video with you on face masks, which was done by the World Health Organization, which gives the guidance to the government on wearing of face masks and PPE. And I'm going to tell you why in a minute. So this is the guidance they give.
Today I'd like to talk to you about how to wear a non-medical mask, also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community, and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be
How many of you got these masks?
fabric.
3 layers?
The inner layer should be water absorbent, and the mid layer acts as a filter. First, clean your hands with alcohol-based
How many of you clean your
hand
hands?
rub
Because I don't
or soap.
when I'm out.
Water. Pick up your clean mask and inspect it. If it
Note
is
how she's
damaged
picking it up.
or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands
Again,
with alcohol
clean your hands.
hand rub or soap and water.
Alcohol rub
As you remove the mask,
can only
lean
sufficient for
forward
three
slightly and remove the
applications.
loops from behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, you can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID-19.
So there we are. All right. That's the video by the World Health Organization, which is remarkable. Right. The question is, a lot of us wear these masks, surgical masks. All right. These surgical masks, at the end of the day, And I know the people watching this, the first thing you do is pull it out of your pocket and stick it on. Oh, that's upside down. So you stick it on blue side out and you get it on there and then you start playing with it. All right. How many of you touch your mask? When we wear our masks in the public, all right, I know I've seen it. A lot of people get uncomfortable. They start touching it. They forget about it. They take it off. They actually take it off a lot of times and then put it back in their pocket. These masks are not designed, and the face coverings they're on about there, she says put it in a plastic bag. The big problem we've got is cross-contamination, which I think the government are not clicking onto. COVID-19 is an aerosol, all right, and it's passed through the air in particles, and the particles are small. These are designed, as being shown by the Health and Safety Executive Research, which was done in 2008, all right, that they're only good enough for big particles. There's a lot of things they put in that World Health Organization video. Wash your hands. I know that people are not washing their hands when they put their masks on, all right? I'm not always washing my hands. I haven't got soap and water there. How can you tell when your mask's dirty? At the end of the day, you're wearing a mask through an environment where potentially COVID, when you put that mask on, you might have COVID on there. So when you take it off and you touch it, it's cross-contamination. Straight away, you could have COVID on your hands. So, you know, my big question is masks, do they really work? And I started asking that question today, especially after I was given change. I went into the shop and I got given my change because I paid in cash. Change. Money loves germs. All right. Now I've got it in my hands, playing with it. So the germs are everywhere. But, you know, and it's been, I haven't changed routine. I've been doing this all the time. So the question is, who's benefiting? Yeah, COVID's real and people are dying. But the masks have been, I'm going to show you now a study which was done by the HSE, all right, Health and Safety Executive. They police all health and safety in the workplace. They look at PPE, they look at, and they do research on PPE. And one of the research documents they actually done was this document here. This was 2008. Evaluating the protection afforded by surgical masks against influenza by your aerosols. And this is what COVID-19 is. All right. And this was done by the Health and Safety Laboratories in 2008. About its gross protection of surgical masks compared to filtering face pieces, respirators. All right. Filtering face pieces, respirators, FFPs. All right. And I'm just going to find an article where it says main findings. The study focused on the effectiveness of surgical masks against a range of airborne particles, using separate tests to measure levels of inert particles and live aerosols. Influenza virus. They use influenza virus. Our findings show that surgical masks provide around 6-fold reduction in exposure. Live viruses could be detected in the air behind. So in the air behind the surgical mask on the tests they've done, all right, don't forget, we put these on to protect, what they say, we put these on to protect others from us. However, I've still got my smell, I've still got my taste, because I've tested that this morning, had a cup of coffee. My taste and smell is still there. That's one of the symptoms you were diagnosed when you have COVID. So I haven't got COVID at this moment in time. But what he's saying is the air behind this surgical mask, which was tested, all right, they still found elements in the test of aerosols behind it. And if you go further in the report, these reports are available on the HSE website, all right? and recommendations. In principle, surgical masks that are worn correctly should provide adequate protection against large droplets, splashes, and contact transmission. They may also reduce some degree of any residual aerosol risk, although this level of protection might not be sufficient to reduce the likelihood of transmission via this route. Likelihood of transmission, all right, of this route. It's not sufficient to reduce it. That's what they're saying. Consequently, they should not be used in situations where close exposure infections of aerosols are likely. The other route we've got is through the eyes. If you look at the PPE that the nurses use, and oh, by the way, there was another study done by the HSC in 2019, evaluation of existing PPE worn by NHS staff for assessment of patients with suspect high consequence infectious disease. This was looking at Ebola, because Ebola was on there at the time. This was 2019. This came out in December. Health and Safety Executive done another research document. All right, and this research document was quite interesting, because today we've got so much PPE that is not fit for purpose, billions of pounds worth, sitting in containers all across the country that MPs procured through their friends, all right, or the procurement process went and run out and got this PPE, and a lot of it is inadequate. This study showed the existing PPE, all right, it weren't up to the standard at the end of the day. Okay. Results. Where is it? They actually done various studies. A basic level of PPE assembly does not afford adequate protection in clinical scenarios such as the one stimulated in research. And they stimulated different, where they had dummies spraying, and they had aerosols, and they done it through fluorescent lights. And I'll show you one of them now, the studies they done, and the basic PPE worn. And care, we're looking at care workers, people work in actual homes, care homes. The PPE they wear, is this sufficient? This is the PPE I know a lot of people are wearing, all right, or wore at the beginning. And this was not sufficient, all right, because what the tests they done, and these are the other types of PPE they tested as well, okay, and they went through the donning and offing. So this is a test they done, but I'll show you now the fluorescent, when they done the fluorescent light, the results, all right, and they done a body map. So what they showed on you was contamination on the PPE exposed skin of a volunteer wearing the enhanced precaution PPE. All right, this after they exercise, this is what they got. All right, when evaluating the existing suspect case PPE assemblies, post-stimulation contamination events noted. 12 post-doffing contamination events. Cross-contamination is massive. And what I'm trying to get to is, you can go into a supermarket, you can watch people going for the fresh fruit. They're moving the fruit. They're actually touching the fruit. However, what's saying their hands are not contaminated? What's saying we're not cross-contaminating and spreading this virus which is out there? Okay? This virus is taking center stage. And, if you see this now, that's inadequate PPE. However, look at the face there. She's got a face shield on. We don't wear face shields around. Why does she wear a face shield? She wears a face shield to stop the droplets going into the eyes. It's a control measure. All right? If she didn't wear the face shield, then it would be all over the face. As you see, droplets on the arm, upper arm, droplets on the ear, droplets all over the clothing, on the neck. Luckily, she got a face shield on. All right? So we've got to look at this, and even the FDA are saying surgical masks. All right, surgical masks are effective in blocking splashes, large particles, droplets, A face mask by design does not filter or block very small particles in the air and may be transmitted by coughs, sneezes, and certain medical procedures. And this is from the US Food and Drug Administration, the FDA. All right, this is their report on it, and they're saying surgical masks, face coverings. Look, are we cross-contaminating? That's the question I'm asking. Are the control measures we have in place today for COVID-19, are they actually working? That's the question we need to pose to the government. Are we creating this virus is spreading, this virus is mutating, and this lockdown, the only thing lockdown is bringing is financial uncertainty, economy ruin, which leads to mental well-being. All right, people are suffering with their mental health today. The government need to start looking at the bigger picture. They need to look at what's going on, and are the control measures adequate enough? Because to me, they're not. To me, we've become complacent. All right, PP is last resort at the end of the day. All right, we need to be looking at a bigger picture. We need to be looking at, we're saying we vaccinate everybody. We haven't even done the safety tests on the vaccinations, and everybody who has the vaccination, just be aware, a lot of the companies who are bringing the vaccinations into the system, into the UK, the vaccinations, they've got to get out of clause. If you were disabled or injured by a vaccination, because they say, there's long-term effects, because they haven't established what the long-term effects are of these vaccinations, is you can't go back, and at the end of the day, they go, what is it called? Indemnity, or immunity. They've got immunity from prosecution. All right, so just start thinking outside the box. All right, because these things here, all right. And I know there's a lot of health and safety professionals out there, all right, who cross-contamination is massive. It's absolutely huge, all right. Disposing of them. I've seen loads of these on the floor. They should be going in a bio bag at the end of the day. To me, they just, the holes, you've got holes around. Questions are going to be asked, how many of these have been tested? Because there's holes through there where you can breathe through. So, government needs to wake up. Government needs to look at needs to look at the bigger picture. A respirator is the way forward. How are other countries dealing with it? How are other countries how's China? China seemed to have got over it. How are the other countries doing? Herd mentality. Do we look at the herd mentality? Do we look at, what do we look at? Where do we go next? Because this ain't working. This lockdown is not working. All right. Definitely not. It's continuing to go forward. Somebody said to me today, we should lock down for 6 to 8 weeks. Just lock the country down. Nobody does anything. And I laughed. And I said, yeah, brilliant. But what happens when we come back out of lockdown and then people start flying into the country again and start spreading it again? All right. The only way we can prevent the spread of this is, unfortunately, is taking it head on. All right. It's unfortunate to say that. We got people suffering with cancer. We got people suffering with other debilitating diseases, other issues going on. All right. And we seem to be just focused on COVID. How many people are dying of other illnesses, other diseases? that we don't know about. How many people are not getting the treatments they, so far as reasonably practicable. So we need to be sensible, all right? And I don't believe the masks are working. I just want to share that today because, yes, I've become bored today, all right? And there's only so much meditation you can do. There's only so much watching programs on TV, all right? It's life. Life is, got to keep yourself amused, and this is how I've kept myself amused today, by looking at the masks, the face masks, the cross-contamination, and the control measures that are in place. And at the end of the day, there's no conspiracies here. It's just questions we all need to ask, all right? Because I go shopping, and when I go shopping, and I'm one of the worst for it, I look for the fresh fruit and veg, and I start moving, I start rummaging through there. I'm like a little rabbit going down his hole and looking for, or a squirrel looking for the food on the floor. But I'm looking in the baskets for the fresh food, and I'm moving food around. Cross-contamination, all right? So read a book, Coops, I've read, all right? I just need to come on here and get it off my chest. Thank you very much, boy Bach. I will get in touch with you today, Coops, because I've done a lot of talking, and there's a couple of people I'm going to touch base with today. I love you all. Just thought I'd share it. Everybody, stay safe. All right, if you're beating yourself up, if you're feeling down, you're feeling pissed off, do something. Go for a walk. Go for a run. There's only so many walks you can do a day as well. All right. Running. Don't feel up to that at the moment. It's too cold. All right. But I think I will. I think I'm going that way. All right. But definitely, I love you all. Everybody take care. Uncle Fester's out.